Good evening. My name is Dale Wetzel. I'm the host of the Legislature Today radio show. We're coming to you from the Peacock Alley American Bar and Grill in downtown Bismarck. We have a nice evening crowd on a frigid evening in Bismarck, North Dakota. And if you're cruising the streets of Bismarck right now and looking for a place where you can have a nice drink and or a meal and a good atmosphere, please come down and you can say hello if you'd like. We're up in the balcony of the Peacock Alley, and we're pretty easy to see because it's lit up like a Christmas tree. First of all, let's talk about what went on in the legislature today. In the Senate approved a couple of bills that offer benefits for military veterans. There's $50,000 to provide a military casket for a veteran who otherwise would get a welfare casket upon his death. A welfare casket is a language that's used in the bill. There's also another bill that provides $50,000 for training service dogs for veterans who have post-traumatic stress disorder. Both of these bills will now go to the House for the review of the House. The Senate also approved increase in pension contributions by both employers and employees for the North Dakota Public Employees Retirement System workers, which constitute the bulk of the state workforce, also judges, the Highway Patrol, and members of the National Guard. This is part of a longer-term plan for restoring the pension fund to some semblance of financial health. North Dakota's pension fund for state government workers is in a bit of a rut presently, as are pension funds in most of the country because of the stock market downturn of 4 or 5 years ago. They're still kind of digging out from that in terms of trying to recover asset values, and one of the strategies for putting these funds back on the right track is to increase contributions from employers and employees. In the House, a sales tax exemption for thrift stores was defeated. The logic of offering this sales tax exemption was that if you buy clothing in a thrift store, it's already been taxed once when it was sold new, so therefore it should not be taxed again. And the argument was made, it should be just like farm machinery. Used farm machinery does not have a sales tax on it. It does have a tax when it is sold new, and so therefore a used good maybe shouldn't have a sales tax. Unfortunately, for supporters of the sales tax exemption for thrift stores, the House did not buy that logic. There was also a bill to overhaul North Dakota's grand jury procedure. Now, this is something that is very seldom been used since statehood, but it did get some attention during last fall's campaign for governor, when a group of Dunn County residents tried to summon a grand jury by petition because they believed that the fact that the Republican candidate for governor and the Republican incumbent, Jack Dalrymple, the fact that he took campaign contributions from the oil industry, they thought that this represented corruption on his part, and they attempted to petition to summon a grand jury to look into this question. Well, they did not gather enough signatures for their petition, and the judge threw it out. Since then, the supporters of this grand jury procedure have filed another petition, and we'll see how that comes out. In any case, the legislature is trying to weigh in on the subject, and one of the elements of a bill on the grand jury process would increase the number of signatures that a person wanting to assemble a grand jury would have to get on a petition in order to compel the convening of a grand jury. Right now, it's 10% of the people who voted in that particular county for the office of governor in the last election. This percentage, according to this bill, which would increase to 40%. So in Dunn County, approximately 1,128 people voted for governor in the last election. So this would increase the amount of signatures that they would need to get from 129 to approximately 510, which is a pretty good load that's a fairly high number of folks to find who are eligible voters and living in Dunn County. There was also a bill presented and approved that would make make it a more severe offense to purchase alcohol for someone who is underage. If someone who is 21 years old or older buys alcohol for someone who is underage, they could face a minimum $500 fine and 40 hours of community service for a first offense. A third offense would be a Class C felony, which could get you 5 years in the state Huskow and $5,000 fine. This bill will go to the Senate. It was approved in the House, and they would also apply if someone who is underage would present a false identification to buy alcohol. This evening on the legislature today, we have on Wednesday nights, we have the University of Mary as a sponsored guest on the second hour of our show, and we have some folks here this evening we're going to be talking about the healthcare programs offered by the University of Mary, and we have some guests here to talk about that. We have Dr. Glenda Reemts, who is the chairperson of the nursing division of the School of Health Sciences at the University of Mary. We have Dr. Jodi Roller, who is the dean of the School of Health Sciences. And we have Representative Bob Martinson, a Republican from Bismarck, a longtime state legislator and also a longtime supporter of the University of Mary. Welcome, everyone.
Thank you.
And Dr. Roller, could you tell us about the School of Health Sciences? What sort of programs does it offer, and how many students
Sure.
use it?
About 2 years ago, we reorganized and made 4 schools at the University of Mary, 4 academic schools, and one was the School of Health Sciences, which is one of the 2 larger schools. And in the School of Health Sciences, we have the huge division of nursing, which Dr. Reemts will explain in a couple minutes. And then we also have the physical therapy, occupational therapy, exercise science, athletic training, respiratory therapy, rad tech, medical lab science programs. And we have a brand new Master's of Science in Human Performance, and I hope I got them all. And the Division of Nursing is further divided, and I'll let Dr. Reemts talk about that.
The Division of Nursing actually consists of both graduate and undergraduate levels, as well as completion programs for undergraduate students seeking their baccalaureate degree. At the graduate level, we have our nurse administrator program, which is further subdivided by those nurses who have an associate degree wishing to go back for a Master of Science in Nursing, as well as a baccalaureate degree prepared nurse seeking a master's degree in nursing administration. We have a nurse educator master's program, and then we have a dual degree with the School of Business to have a Master of Science in Nursing, as well in the nurse administrator with a master's in healthcare administration. We're seeking in the future, hopefully, the Doctorate of Nursing Practice, and that's pending approval by the Higher Learning Commission. We're anticipating that we will gain approval for that and look to start that program this fall. We have a full cadre of undergraduate students in the traditional baccalaureate program here on campus. And typically when we speak enrollments, we typically will have up to 60 students in the undergraduate program. Our graduate programs vary. We have both on-site and online programs. We have distant sites that in Fargo and Kansas City that have our on-site satellite areas for those graduate programs.
How long does it take to become a registered nurse at the University of Mary, to complete the requirements for doing that?
For the traditional student coming in, it's a 4-year program. We also have the completion program, so nurses who already are licensed either with a licensed practical nurse can come back and get their baccalaureate degree, as well as those nurses who have an associate degree and are registered nurses and want to come back and can get their baccalaureate degree.
And if I'm coming in from a standing start and I want to be a registered nurse, how much is it going to cost me? Approximately.
I think the tuition now is about $12,000 a year, between $12,000 and $13,000 a year. So just take that times 4.
All right, I think I can do that. Dr. Reemts, what is the job market for graduates of the nursing program?
Well, that's very exciting for us because the healthcare industry is exploding, and Jodi will talk about some of the other programs within the School of Health Sciences. But we see that the job openings are wide open pretty much for nursing. We'll be anticipating a rather severe shortage as our aging population is continuing to boom with the baby boomers, obviously, and then the aging population of the majority of nurses who are in the workforce as they reach retirement age. So the job outlook is tremendous for nurses. And in fact, shortages exist for nurses in a lot of areas, particularly the underserved rural areas sometimes have more difficulty finding nurses. But even in our urban areas, we're finding that our graduates are being sought out before they even graduate.
What do these folks get paid?
That, once again, is going to be dependent on the area in which they're practicing. I would say probably...
According to the Bureau of Labor Statistics, which I looked up today, is about $65,000 for a nurse. But it didn't really say if it was a brand new nurse or...
Mm-hmm.
But I think it's average.
That's a nationwide average.
Right. It's probably a little less.
And if I understood you correctly earlier, Dr. Reemts, these people are being recruited before they even graduate from college.
That's true. There's a shortage here in Bismarck. Our acute care facilities and the long-term care facilities are actively recruiting our graduates before they graduate.
And the folks who graduate from your program, your nursing program, where do they go to work? Do they go to work in hospitals, clinics, nursing homes?
Well, they're educated in all those areas, and I would say that probably the most sought-after jobs initially tends to be the acute care facility because they can gain a lot of their clinical skills and refine them in the acute care areas. But our long-term care facilities are really needing nurses in a desperate way as well. So we're trying to excite our nurses to be ready and willing to accept those jobs in long-term care as well as the acute care areas. But that isn't the only area. Obviously, with a baccalaureate degree, they can seek and find jobs in public health, community health, school health, government agencies. It just is very wide open.
You mentioned there are 60 students in the undergraduate program approximately. Is that what was it 5 years ago? What are the trends here?
Well, I think we're seeing the pendulum swings. You see a decrease, and then all of a sudden you'll see an increase. And we're really on an up. We hope to be on an upswing because of the need. But our enrollment tends to be pretty steady. And our enrollment really is based on the number of students that our facilities can handle. So we have to have places for them to gain their educational experiences. And that tends to be the most limiting factor in terms of what our enrollments can be.
And how old are your students generally? Do they come to you out of high school, or are they older than that?
Well, that is increasing in age. I see more older than average students coming back now than we probably had years ago, as well as second degree. A lot of students are coming back. They know that nursing is an opportunity where they're going to have a job. They know that they'll be able to seek and find a job in nursing when they finish school, as well as the advanced degrees are very lucrative. So knowing that they can go on and become a nurse practitioner, they can go to be a nurse anesthetist, those are very lucrative paying positions. And so they obviously have to have that baccalaureate degree in order to advance to those advanced degrees.
We'll come back to that in a moment, if you don't mind. Dr. Roller, the other programs that are part of the School of Health Sciences, could you, what is the most popular one amongst that group, excluding the nursing program?
Well, I'd probably have to say physical and occupational therapy. They're both separate degrees. It's the Doctorate of Physical Therapy. We have approximately 350 applicants for about 36 positions each year. And for occupational therapy, they just interviewed last week about 70 to 80 students for 38 positions. So they end up with a waiting list. Our age students are generally a little older because they are graduate students, so 23 to 25 years old probably. The occupational therapy program is starting a program in Billings, Montana. It's going to be a University of Mary program, occupational therapy program in Montana, and it's the only OT program in that state. So we're going to start out with 12 students in Billings next fall, and they're going to be teaching them through technology from our campus with faculty, 1 or 2 faculty out in Billings.
How did that get going?
It was an idea of the director, Dr. Janine Sibla, and she realized that there was no program in Montana, and following the University of Mary mission to serve the academic and cultural needs of the people of our region and religious needs, she just thought about, why don't we try to start that? And so we went out to Billings. We do have a site out there, and looked over the facility and decided we could do this. And with all the paperwork and everything necessary to get that done, it has become a reality, and we're advertising for that position.
What's the job market for occupational and physical therapists?
Very, very good. Again, using the Bureau of Labor Statistics, those are 2 professions that are growing faster, much faster than average. Within the next 8 years, there's more than 30% jobs. I think physical therapy is 39%. The jobs will increase by that much.
The physical therapist, what types of patients does a physical therapist work with?
Well, we work with all kinds. There's 4 major areas. We work with people with cardiopulmonary problems, cardiac rehab. We also work with patients that have neurological problems, such as multiple sclerosis, spinal cord injuries, traumatic brain injuries, and then the pediatric neurological problems like cerebral palsy. Musculoskeletal, everyone knows that, and everybody's got those problems, so back problems, knee, ankle, every joint. And integumentary, which is probably would surprise some people, but we do work in wound care.
And what's the word you used?
Integumentary?
Integumentary. I'm going to have to try to spell that after the show. Occupational therapy, what is that?
Occupational therapy is very strongly related to physical therapy, and in fact, we do a lot of the same things together. Physical therapy probably is more related to the actual improving of the physical self, whereas occupation is occupation-based, and occupation-based means more than just going to a job. It means what do they do for the day. That's getting up and getting ready to go in the morning, brushing your teeth, washing your face, the occupation of trying to cook and clean and those kinds of things. So they work more on the functional skills, and it's a very much growing profession, as people really need that in baby boomer generation, as Dr. Reemts suggested.
Representative Martinson, what does the legislature do in order to try to encourage folks to go into the healthcare professions? Is there anything in particular?
Well, if you're talking about specifically the University of Mary, we have a couple of programs that go through the university system that do give grants for students at the University of Mary, and that's not specific to the healthcare programs, but students in general.
Are there programs that deal with healthcare providers across the spectrum of higher education?
We do some of that, but not specifically for the University of Mary.
Okay.
But we're very aware of the fact that we need medical professionals in North Dakota, and particularly western North Dakota.
Dr. Roller, you mentioned earlier radiological technician. Mm-hmm. I don't know what the term is. What does that person do, and what is the job market for that person?
We shorten it up to RadTech.
RadTech?
Yeah.
That sounds like a rock band or something.
They're the people in our hospitals who, if you need an X-ray, if you need a CT scan, a mammogram, they're the technicians that work with in that area.
They're the people that put the lead apron on you?
They do that, yes, they do.
All right. And what other programs have we not talked about that you're...
Well, I'd like to mention our new master's degree, the Master's in Human Performance. It has 3 concentrations, and it's really designed for people who already have a bachelor's degree in either athletic training or exercise science, or our coaches and athletic directors out there, so that they can upgrade to a master's degree. So there's a core curriculum, and then they can branch off in one of those three directions: sports and administration, or human performance, or exercise physiology.
I was reading the New York Times the other day, and there was a headline that said, "Don't make fun of the gym majors anymore because they make good money." What is the job demand for a Masters of Human Performance?
Well, I think that is also growing. Exercise physiologists are needed out there to work with the bariatric population. These are the people who have obesity, probably had surgery, a lap band surgery or gastric bypass surgery, and they need that follow-up for exercise. And that's very much going to be a growing field. We just have to figure out who's going to pay for that, which always is a problem. Human performance, that's getting our athletes in tip-top shape.
This the enrollment in your school, has it been going up and going down? Is it steady? What are the trends?
Our enrollment is going up. Our probably faster than any other school on campus. We now have about 680 professional students, and that doesn't include the freshmen and the sophomores. And I believe it is because they can get jobs. There's many of our students get 4 or 5 job offers before they even get out of school, especially the PTs and the OTs.
One of the things that was interesting to me is you mentioned that there were 300 plus applicants for a much smaller number of physical therapists and occupational therapists training spots. Have you tried to expand your number of training spots?
Yes, we are always working on expanding our number of training spots. For the therapies, it's a little bit different than nursing. We use the United States of America, even Alaska and Hawaii. So we have clinical sites in many, many states, and we send them out for a period of time, and then they come back, and then they go out again, etc. So we're always trying to do that. We're trying to expand the numbers. When we first started, I am a physical therapist, so I know the most about that. But when we started that program several years ago, and the OT program, we tried to start with 30, but we never filled our classes.
Let's hold that thought for a moment.
Okay.
We've been speaking to Dr. Jodi Roller, the Dean of the School of Health Sciences at the University of Mary, also Dr. Glenda Reemts, the Chair of the Nursing Division at the University of Mary, and Representative Bob Martinson. Thank you. My name is Dale Wetzel. I'm the host of the Legislature Today radio show. We're coming to you from the Peacock Alley American Bar and Grill in downtown Bismarck. This is the University of Mary Hour. We have guests here from the University of Mary's health program. We have Dr. Jodi Roller. She is the Dean of the School of Health Sciences at the University of Mary. And her first name is Jodi. I think I called her Judy just before we left for the break earlier. I'm sorry about that, Dr. Roller. Dr. Jodi Roller, of course.
No problem.
And we also have Dr. Glenda Reemts, who is the chairwoman of the Nursing Division of the School of Health Sciences. And Dr. Reemts, I understand that you're trying to establish a doctorate of nursing practice at the school. Can you tell me how that's going and what the reason is for doing that?
Well, there's been a national movement recently to move the practice doctorate to a DNP based largely upon the need. Currently, they're just looking at our market analysis and the needs assessment that we completed to begin our doctorate in nursing practice. There were 30,000 national job postings, of which 151 were just in North Dakota alone. So we know that there's a great need for this level of practice. And probably the impetus for moving this direction is the bottom line always is patient safety. And looking at ways that we can increase the breadth and depth of their experience in taking care of clients is always our number one goal. Plus, we know that there's a huge shortage of primary care practitioners nationwide, and the DNP will be exclusively, or not exclusively, but will be well prepared to meet that need.
And when we say DNP, we're talking about the Doctorate of Nursing Practice, right?
That's correct.
And can you tell me, you used the term level of practice. Can you tell me what that means and why it's important?
Well, the level of practice, the doctoral level is a terminal degree, and it moved in that direction, too, to be kind of commensurate with the other practice doctorates, like in physical therapy, occupational therapy, I think is trying to move in that direction. We have chiropractors, you have optometrists, all within that same level of practice. So this elevates the nursing practice doctorate to those levels to be in line with that.
What could a doctorate, someone who holds a doctorate in nursing practice, what would they be able to do that, say, a registered nurse could not do?
Well, their scope of practice is broader. They, in many states, and this is moving more nationwide, have prescriptive privileges. So they function as that nurse provider. We like to say that they provide holistic care to their clients. They treat not only the physical, but the social, psychological, spiritual needs of the clients. That fits well with our Benedictine mission. And the patient populations that are served by family nurse practitioners, which our doctorate in nursing practice would focus on the population of family nurse practitioner, and they find that they have high satisfaction rates when they have a nurse practitioner caring for them.
How long would it take to get a doctorate of nursing practice?
Well, it's 3 years.
After they have a nurse. They have to be a BSN first.
That's correct.
I don't know if I'm treading on sensitive turf here, but could a holder of a doctorate of nursing practice be a surrogate for a MD in an underserved medical area?
Well, that is why we want to prepare them. They are able to serve independent. They have more of an independent practice. So yes, they meet those needs in those not only rural areas, but our urban areas as well.
And they can prescribe medicines, if I understood you correctly.
That's correct.
And what kind of demand do you see for this degree? How many folks do you think will be enrolling in it?
Well, we have a high demand. We currently accept 24 students in our master's program, and we're hoping to continue that into our doctoral programs. And we see about what we are interviewing this year, about 80 applicants for our 24 slots.
What's the difference between a doctorate of nursing practice and an MD?
Well, a doctorate in nursing practice focuses on nursing as the underpinning, whereas obviously a medical doctor focuses on the traditional curative model, whereas in nursing you're focusing on a care model.
Okay. And how many nurses who are practicing presently are looking to move up in this credential?
Well, the need is certainly there and the interest is certainly there. We know that the number of DNP programs has escalated significantly in the past few years, and it has surpassed actually the number of PhD programs in nursing. And it is popular because it focuses on practice and improving practice, and it is practice-based versus research-based.
How long has this been in the planning stages?
Oh, we've been working on it for about 3 years.
And when are you going to start?
Well, once again, if we get approval by the Higher Learning Commission, and we're anticipating that will be positive, we're hoping to enroll our first group this fall.
Dr. Roller, are there other doctorate-level programs in the School of Health Sciences?
Well, the physical therapy program is a doctorate, and that's the first doctorate on campus. Right now it's the only doctorate on campus. This would be our second, and we're also working on a doctorate in education.
Why would one earn a doctorate in physical therapy?
Well, that is the entry level.
I'm sorry.
That is the entry level degree now for physical therapy.
Okay. What is it that a physical therapist learn? I mean, why is it called a doctorate if it's an entry level job?
Because I believe it takes at least 7 to 8 years to become a physical therapist.
I see.
We have a program that is about 125 credits long, so they go 8 semesters in order to get their doctorate.
What sort of arrangements do you have to work out in order to have the training of medical professionals at the school with such things as like local hospitals, nursing homes, clinics? Can you talk about that?
we're very well connected to our local hospitals and clinics, and we're very happy about that. And we want to thank them every day, because they have to learn bedside, they have to learn with patients. For physical therapy, we have a clinic on campus. It's called the Care Clinic. That Tuesdays and Thursdays from 3 to 5, we see patients, and we set it up just like a clinic so that they can get that extra practice. But the physical therapists go out for 32 weeks in 4 separate clinicals throughout the United States with a one-on-one or two-on-one clinical instructor. Occupational therapy has 4 solid months of occupational therapy practice after they've been in school for 2.5 years. So we use lots of different clinical sites.
Dr. Reemts, how much do you rely upon connections to local hospitals, medical facilities?
Well, just like Dr. Roller indicated, we rely heavily, and we are very appreciative of the many healthcare organizations that partner with us to allow our students to be working within their organizations. In our family nurse practitioner program, currently there are 900 clinical hours. So those hours can take place in the student's home area. We have students come to campus for a period of time to do some of the competency testing that's required, but the grand majority of their time is spent in their home areas, gaining that experience that they need with their local practitioners. So we very much are integrated throughout the communities.
Where do your students come from? Do they come from North Dakota mostly, or they come from elsewhere?
They come from all over, mostly North Dakota, South Dakota, Montana, eastern Montana, and Minnesota. But we get them from all over.
Does the fact that they're trained at the University of Mary, does that give, like, do Catholic hospitals, such as St. Alexius Medical Center here or elsewhere in the state or country, do they have a natural affinity for graduates, or do they have dibs on them, or is there some sort of arrangement there?
I would say some of our graduates like to work at Catholic hospitals, but it all comes down to who can give them the job they want.
And who can pay them, I imagine.
That's exactly right.
How much your students that come in, what motivates them to go into, well, Dr. Reemts, let's just talk about nursing. What motivates your students to go into nursing?
Well, it's certainly an occupation that you have to have the heart for. It's not something that you can say, okay, I want to be a nurse and be a nurse. You really have to have that ingrained desire to want to help others. So those people that have that need and that connection with people, you have to be a people person. And you have to be willing to be have close contact and intimate involvement and not be too afraid of bodily fluids to go into nursing. So it's not an occupation that one takes lightly. You can't go into it just because mom or dad think you should be a nurse. It has to be something that individual truly enjoys.
Dr. Roller, the other folks in this part of the school, physical therapists, occupational therapists, why is it that they go into that profession?
One year, a few years ago, I asked a group why they came to be a physical therapist, why they want to be physical therapists. About 95%, I want to help people. And so it's really the same thing. And it is healthcare is tremendous because it's kind of what we preach at the University of Mary. It's not about me. It's about what you can do for other people. And that brings back a whole sense of fulfillment to the individuals. And they learn that early on, that if they are helping somebody else, they get their own fulfillment. And that really keeps them, it sustains them. And they can be fulfilled in their profession.
One of the things that one hears about the practice and the provision of medicine in this country is that sometimes, like hospitals or clinics, when it comes to nurses in particular, that they're short-staffed, that they don't have maybe as many nurses as they should, or many because of cost considerations or whatever. Is there anything that you do to prepare your students for that sort of working environment? Or is the point I'm raising even a valid one?
No, it certainly is. Because of the impending nursing shortage, we do have to prepare our students that they're going to be functioning under pressure. That's just part of the curriculum in which they're exposed to. We certainly hope to be able to alleviate some of that through our graduates, producing the number of graduates that we do. But they're put into the real-life situations when they're caring for their clients. And they have a capstone project in their senior year. It's called our preceptorship experience, where they actually follow a nurse and work their schedule and take care of the client population that they take care of, so they get a real-life feel for what it will be like when they graduate.
How are they taught, and part of this question is frankly meant to be in a jocular fashion, how do you teach your students to deal with patients, particularly difficult ones, and how do you teach them how to deal with arrogant doctors?
That's a people person skill, and that comes through, I think that comes through role modeling from their faculty members, because certainly when you're dealing with clients, they're at their most vulnerable times in their lives, and some of those situations are tenuous, and you have obviously a physician that cares a great deal about how their client is going to respond to their care, and you want to teach your students to remain calm under the face of frustration. And once again, I think it's hopefully role modeling the ability to do that, and then visiting with our students when situations like that do come up in a post-conference on what went well, what didn't go well, and how would you change it? How do you think you would respond in a better fashion?
And we don't want them to be arrogant. So,
of course,
we stress that too.
Well, see, the thing is that I imagine, I think that when nurses have much more direct contact with patients than do doctors. And, frankly, people expect doctors to be a little highfalutin, I think, and they don't expect that of a nurse. Speaking of I'm interested in how the nursing profession has changed over the last 10 years, 15 years, whatever time frame that you think is appropriate. What sort of new demands are there on the nurse who's working in the hospital, who's working in the clinic, in terms of their training, in terms of just the demands that are put on their expertise?
Well, technology, I would say, is probably the key factor. We've escalated so rapidly, and things that you're teaching today may be obsolete tomorrow. So becoming accustomed to and flexible to change, I think, is a key characteristic. We know that there will be newer technologies evolving, and having that fingertip technology, I think, is one of the biggest changes that we have. They have the devices in their little hands that they can access medications, they can access nursing interventions, they can look up medical diagnosis, and a lot of times patients don't realize that these devices that the nurses may have are actually benefiting them, so they have to do a little educating, especially of the older population, that they're not just surfing the web, that they're actually accessing care that will improve their outcomes. So I would say technology is probably the biggest factor that's changed.
Go ahead. I'm
sorry.
The
teaching with technology too, because now we have a sim lab. So you want to talk about that?
Sure.
What is a sim lab? Yeah.
Well, we have what we consider to be a high fidelity simulation. We have two labs, one in which has an adult mannequin that is very sophisticated. It is the type where you can program it to change its respirations, its blood pressure. You can have it have a code. We do a great deal of moulage, so they are bleeding. And the students come into this environment. It's set up much like a hospital room. And students, without a faculty member standing over their shoulder, have to contend with this scenario. And it's videotaped. And once the scenario is over, they go into a debriefing room, and you talk about how the scenario went. You like to have that student think through how they might improve the care of that client and how they responded to it. So it's a safe environment for the student. We have a birthing simulator. We have a pediatric simulator. We have a newborn simulator. So we really, that technology has allowed us to provide a more standardized patient for our students, and so it also helps us in assessing our students, because you can provide the same scenario and see how they respond.
If you have a dummy that, if I may use the term, that bleeds and has a heart attack on command, the thing that when you started talking about this dummy, if I may use the term, the first thing that popped into my mind is, what is its name?
We had our adult mannequin is Sim Sam. That's the name. We'd had a naming contest last year. Noelle is the name of our birthing simulator. Hal is the name of our pediatric simulator.
Why is Hal called Hal?
That's actually the brand name.
I was wondering,
Pediatric Hal.
Does it have any relationship to the 2001: A Space Odyssey, where they have a computer that talks in a very creepy voice?
No.
Gee, I'm disappointed.
Although, it's interesting, though, because when the faculty members control these simulation experiences, there's a microphone in the mouth of these mannequins. And so you can either use the standardized responses, or you can actually be the patient. So you can have somebody that can actually speak, and then it's coming out of that mannequin's mouth.
To what extent is it more difficult to be a nurse or be an occupational or physical therapist because of the increase in healthcare regulation in the last 10 to 15 years?
Overall, it's difficult to plan because we don't know exactly what's going to happen. But for the occupations of physical and occupational therapy, it's reimbursement. It's always a concern of how much they're going to get reimbursed, and then they switch the paperwork, and so we got to learn a whole new different way of doing things. And so it's all about efficiency and getting to see as many patients as you can and take good care of them and still get all that paperwork done.
I would say that's very true for the nurse practitioners and their independent practices. That's all reimbursement driven. In terms of nurses in the hospital situation, we have to be good stewards of the environment. We know that we have to do more with less. That's just the nature of our business today.
I mean, how do you teach your students, and I don't know to what extent they have to know this, but how do you teach them, how to deal with insurance companies, how to deal with federal healthcare regulations? And, we have a very, expansive federal healthcare law taking effect, and we have the HIPAA law, which is a fairly recent phenomenon. How do you fold all of that into your instructional program?
We have several courses. They're practice courses on just those things. They learn all about that. And also how to find things in CMS or the internet so that they can figure it out in the future. Because as Glenda said, what we teach today is not going to be the same as what they have to deal with out there.
Does it drive any of them away? I mean, the idea of, diving into the healthcare regulatory morass?
They might not like it, but I don't think it drives them away.
No, I think, especially for the advanced practice nurses, they go into that because they want more autonomy. They want that control, and they're eager to learn about the regulatory aspect of it. They might not like it, but they know that they have to contend with it.
So where do you see the future of nursing and the people that you're educating right now? What do you think is coming up on the horizon that is going to pose the biggest challenge to you as educators?
I think overall they are going to be more and more autonomous. So less and less supervision from a physician and more out there on their own just because of doctor shortages and those kinds of things. We're educating them all to a higher level. That's why we increase the degrees. They used to be bachelor's degrees. Now they're master's and doctorate degrees.
Mm-hmm. I would have to echo what Dr. Roller just said. Out on the horizon right now, we have that baccalaureate entry. It may even move to a master's level for that entry level for nursing. Although nursing traditionally has such multiple levels for entry, it might be a difficult arena to get through, but certainly that is the hope of the high talkers in the area of nursing.
Yeah, and I want to add, we have athletic training and exercise science, and that master's in human performance is their next level that they're teaching.
What's fun about the School of Health Sciences?
It's fun because when you're around students, they invigorate you. They keep you young. It's a wonderful environment to be in for academic inquiry. You're learning new things all the time. It doesn't stay stagnant. You don't teach the same thing year after year because things change rapidly. I think keeping up with it is a challenge, but I think that's what makes it very enjoyable.
And the students are fun. They have to relieve their stress, and so there's always fun things that they're doing.
Well, let's hear about that. What are some of the fun things that
they have? Their dress-up days. They do a lot of service, so they may have a charity that they choose, and then if you have to pay a certain amount of money to dress up funny, and I've seen them come to class looking rather odd.
Okay, let's get into that. What is rather odd?
Let's see if I could even remember. Oh, I would rather not say.
I was going to say, you don't have anyone dressing up as, I don't know, Abe Lincoln or...
I will tell you, though, that I've given an individual lab test to a girl dressed up as a cat on Halloween.
Oh, my goodness.
It was rather odd.
How'd you manage that?
Quite well, I think.
I'm sure you did. We've been speaking to Dr. Jodi Roller. She is the Dean of the School of Health Sciences at the University of Mary. We've also been speaking to Dr. Glenda Reemts, who is the chairwoman of the Nursing Division of the University of Mary's School of Health Sciences. And we also have been speaking very occasionally to Representative Bob Martinson, who's a Republican member of the state legislature and a former House Republican majority leader. And thank you all for coming. And this has been the University of Mary Hour on the Legislature today. Thank you again for coming.
Thank you for having us.
It's been a lot of fun.
Thank you.
Take care.